Welcome back to County Connection. For this next segment, we are going to be talking about traumatic brain injury prevention. And here to enlighten us is Jennifer Kagan, who is a nurse navigator, program coordinator for traumatic brain injury and telemedicine programs at St. Anthony Summit Medical Center in Frisco. Did I get all that right?
It's a long title.
It is a long title.
Yes, you got it right.
So thanks for bringing all this expertise to share with us today. So Jen, let's start with a quick definition of traumatic brain injury.
Sure. So traumatic brain injury is really any type of blow or jolt to the head, neck, or body that would cause an injury to the brain, or even kind of a temporary interruption of normal functioning. And a concussion is a type of traumatic brain injury.
Okay, so we hear kind of a lot of different names floating around, so can you kind of give us the glossary of maybe terms that that we've heard and how they might be different?
Yeah, I think traumatic brain injury can kind of be the umbrella, cover the whole gamut.
Okay.
A concussion might be referred to and word used interchangeably as a mild traumatic brain injury.
Okay.
I am hesitant to coin things either mild, moderate, or severe because everybody's a little bit different.
Okay.
And sometimes you'll hear the abbreviation TBI a lot, which stands for traumatic brain injury.
Okay.
But those are probably the three that you'll hear, at least in our community, most frequently.
Okay. So now that we've gotten the terminology down, how prevalent are traumatic brain injuries locally?
They are very prevalent. It is the #1 trauma diagnosis at Summit Medical Center in Frisco. And in the county, and in Summit County. I think approximately, well actually I can tell you, I just got the statistics for our last calendar year from October 1st of 2015 to October 31st, 2016. Summit Medical Center diagnosed 900 traumatic brain injuries. Yeah. Now that can be quite a variation of how severe or what other injuries, but that could be a concussion or that could be a very serious injury.
Okay.
But in the last calendar year, 900 in our community.
And so does that vary seasonally at all? Can you tell kind of what's going on outside by what you're seeing inside the medical center?
Yeah, it used to be that our biggest time for the whole county was the ski season, but we see probably just as many traumatic injuries and head injuries at the hospital in the summer months as well.
Okay.
But numbers-wise, as far as the ski clinics, the Keystone, Breckenridge, and Copper Mountain ski clinics, I would say annually they report around 250 diagnosed traumatic brain injuries per clinic.
Okay.
So again, that's quite a bit. And also thinking locally of all the patients that we see in the emergency room at Summit Medical Center, 15% of those are diagnosed with some sort of a traumatic brain injury.
Okay. And so what do the stats look like statewide, nationally, kind of beyond Summit County?
Yeah, so the Centers for Disease Control reports that we see about 3,800,000 sports and recreation concussions annually. Now certainly those numbers will change a little bit, but that's a national concussion statistic.
Okay, and that's annually, you said?
Yes.
Okay, so almost 1% of the American population per year. Wow.
Yeah. Yeah.
Okay, so what are the common signs and symptoms of TBI?
Yeah, good question. I think, again, the symptoms can vary with each individual. Everybody's brain is a little bit different, but I'd say some of the most common symptoms after a concussion or head injury are a headache, maybe some brief confusion, some dizziness, nausea, there may be a little bit of vomiting sometimes. And then longer term, people may notice some issues with vision or balance, and even kind of some emotional instability, some sadness, irritability, depression, or anger.
Okay. And so if you have had some kind of a trauma to your head and you are experiencing symptoms, or even if you're not, I guess, what should you do in the way of seeking treatment?
Well, we always recommend if you have had any kind of a blow to your head or any traumatic injury to always get checked out by a medical professional. And ideally, if you are diagnosed with a concussion, really the recommended treatment or management for a concussion of any severity is rest, to rest your brain and rest your body. So decreasing physical and cognitive stimulation, allowing yourself plenty of rest. And then really it is a sort of a graduated, stepwise process to return to your level of activity after you've been cleared by your medical professional.
Okay.
So initially we want you to rest. Sleep is great. People used to think, we have to wake you up every hour, make sure you wake up, but really the best thing for the brain is sleep and rest.
Okay.
And then once you've been cleared by your physician to return to your level of activity, we recommend that your medical provider and yourself and your family or your teacher all be involved in kind of the program to develop to get you back to your level of functioning.
Okay. And we know that the best strategy for, or better than a cure, is prevention.
Yes.
So what are all the things we should be thinking about in terms of preventing a TBI or concussion?
Right. So really the number one thing is to make smart decisions. We want to remember to wear our seatbelt. We want to always remember to wear a helmet when we're doing high impact activities. We want to avoid situations where violence can occur or making bad decisions about drinking and driving, anything like that. So always making the best decisions that you can. And then prevention, if you're out on the slopes, if you're on your bike, always wear a helmet, and if you have any kind of an impact, replace your helmet.
Okay. Even if there aren't visible signs of cracks or anything like that, it's
Yeah,
still...
absolutely. Most helmets are designed to take the impact of one hit.
Okay.
So the inside of your helmet, whether it's the foam or the cushioning, that will absorb the shock. So even if you don't see any kind of visible damage, if you've taken a hard enough impact where you're thinking, wow, I hit my head, you need to replace that helmet.
Okay, that's good to know. So there are a lot of activities and organizations that are working on this issue of traumatic brain injury. So tell us what's going on throughout the community.
Okay. So at the hospital, we have a program focused on traumatic brain injury, and we offer 2 monthly support groups where we will meet for topics of discussion or camaraderie or get-togethers. And we also offer education for the community, where we will bring in speakers or put on an annual seminar, both for kind of the lay person, family members, coaches, teachers, but also healthcare providers. Most recently, we developed a educational video called Impact Free, and we've been showing that around the community and the schools to clubs and sporting groups and teams, really to kind of get the word out there for prevention and what individuals can do for themselves and for others to heal from a concussion or traumatic brain injury.
Great. So what information resources do you recommend if people are interested in learning more about traumatic brain injury prevention or treatment?
Right. Well, I think certainly people can contact me as the nurse navigator for the traumatic brain injury program at the hospital. You can contact me by phone or email. But I also think really your primary care provider is an excellent place to start, whether that's your physician at High Country Healthcare or you see someone at the clinic or the ER. But really your primary care provider is the best place to start if you have questions or concerns about a head injury. Avalanche Physical Therapy has a specific neuro rehab program where they work with people who are having balance or vision issues, memory issues. Again, our support groups, and at the hospital, our program, we work very closely with the Brain Injury Alliance of Colorado, and they are a state program, nonprofit organization that is available to anyone who has questions or needs resources about brain injuries.
All right, awesome. Well, let's see, is there anything else that we haven't touched on this topic, or have we covered it all?
Well, that's kind of just the beginning.
Sure.
But yeah, I guess I would just say to always wear your helmet, make smart decisions, and if you have any questions, you can call me at the hospital.
Excellent. Thanks so much, Jen. It was great to have you. Thanks
Great.
for sharing all this great info with us. And yeah, and we'll look forward to a safe holiday season out on the slopes.
Sounds good. Thank you.
All right, stick with us. We're going to take a quick break, and when we come back, we're going to be talking about snow removal.